Have you ever started a treatment for something and it just did not quite work out as planned, leaving you wondering what comes next? It can be a little frustrating when you have done everything right, but your symptoms persist. When an initial treatment for an H. pylori infection does not succeed, doctors typically move to what is known as salvage therapy. This means they will prescribe a different combination of antibiotics and other medications to target the resilient bacteria more effectively, aiming for a successful eradication. The primary reason an initial H. pylori treatment might fail often comes down to antibiotic resistance or patient compliance. H. pylori bacteria are quite clever, and they can sometimes develop a resistance to the first line of antibiotics used. Additionally, if the medication is not taken exactly as prescribed for the full duration, the infection may not be fully cleared, allowing the remaining bacteria to multiply again. Understanding these factors is crucial for tailoring the next steps in your care. To address a failed H. pylori treatment, your doctor will likely review your medical history and potentially order new tests. These tests often include a repeat breath test or stool test to confirm the presence of H. pylori and sometimes even a sensitivity test to see which antibiotics the specific strain of bacteria responds to best. Armed with this information, they can then select a salvage regimen. This new regimen commonly involves different classes of antibiotics, sometimes at higher doses or for a longer duration, often combined with a proton pump inhibitor and possibly bismuth subsalicylate. A key strategy in salvage therapy is to use antibiotics that were not part of the initial treatment, especially if resistance is suspected. For example, if your first treatment used clarithromycin, your doctor might switch to a levofloxacin-based regimen or a bismuth quadruple therapy, which is a powerful combination often reserved for difficult cases. This approach ensures that the bacteria are exposed to new agents they are less likely to resist, significantly improving the chances of success. Ultimately, successfully treating a persistent H. pylori infection requires a careful, individualized approach from your doctor, who will meticulously consider why the first attempt did not work. They will then use their expertise to select a more potent and tailored combination of medicines, leading you toward better health and freedom from the infection.